For someone who's had COVID, they will mount an antibody response to it. We find that in the tests that have been done, it's relatively short-lived. And so when I say relatively short-lived, a couple of months is probably what we think that antibody response will last. And that's been looked at in lots of different populations around the world. And it's fairly consistent with the whole family of coronaviruses, where we have seen for years that the common cold will infect you every year or a couple of times in a year. So not really that big of a surprise. We know that the vaccine, I guess, helps to mount a broader response to the COVID virus. And so whilst we've got lots of different variants that have progressed since we've first learnt about COVID, we know that the vaccine gives, I guess, a slightly broader immune response. And so those children who've been vaccinated and then experience COVID are likely to have a better antibody response based on that. Will it protect them from the next variant? It probably will, but it's also hard for me to give a really solid answer to that because we don't actually know what that next variant will look like and how relevant this particular vaccine will be.
So we know that anxiety is part of all of our lives. We get frightened from time to time, and it's got a really adaptive kind of response to fear. But when we start to get concerned with anxiety, we look at about a 6-month sort of time frame. So what we might be seeing with the current COVID is perhaps an exacerbation of a naturally more cautious, anxious child. So over about 6 months, is the child's worry starting to take over? Are they worried about everything? And is that worry generalized to all aspects of their life? Then we look at their sleep. Has their sleep changed? Are they sleeping less? Are they finding it hard to get to sleep, waking up in the night? Is their appetite changing at all? We look at what we call hypervigilance, which is a real inability to concentrate, looking all around, worried all the time. Are they having any physical symptoms? Are they saying that they're finding it harder to breathe, if their heart's racing? And all of these things, again, are very easily available on the Kids Helpline website, and that will tell you when to worry. So while all these things are pretty transient, they come and go through our children, if you start to see this in a prolonged period, that's when you might want to contact your GP, who can then refer you on to other services.
The school might not provide the child going home with the same work that the class is doing, because quite often you can't predict exactly what that's going to be, and teachers are adapting to the children's needs as they're teaching. Quite often teachers will provide work online, and there's access to online work. Quite often they've made pre-packaged work packages for students. It really is about routine. So teachers don't necessarily want students at home waking up and doing the exact same school routine they would at home. It's just not sustainable. So they're really just trying to keep them in the habit of studying, doing a bit of reading, doing a bit of maths, maybe writing a little bit, having some free time. So they don't need a lot of work. And the thing we've been telling school leaders when they've been calling us around this is, if a student does need to isolate for 7 days and we take a practical approach to this, unless they're tested positive on a weekend, really we need about 4 days worth of work and not full 4 days. Because on day one, if it's a school day, there's all that testing taking place. There's all that, what do we do now? Who do we tell? Where were we? So day one's gone. So then you've got a weekend in there somewhere. So you're really left with sort of 4 days to think about what's going to keep our child active and in a routine at home without making it school at home.